Late last week, members of the Massachusetts Senate unanimously approved a law that would, among other things, cap the cost of some prescription drugs. It's a move that not everyone is happy about. State Senator Adam Hinds of Pittsfield, a member of the Healthcare Financing Committee, spoke with me about that and more ahead of lawmakers' recess, which starts Wednesday and runs until January.
It's pretty simple. We've seen polls where 84% of residents believe that they're paying way too much for prescription drugs. We've seen 9 out of 10 say that Congress needs to do more to address the cost of medicine. And so this is something we hear about every single day. We know it's a big problem. We know that people are making really unfortunate choices between life-saving medicine and other important costs. And so this has been a deliberate effort to say, what are we doing to address the cost drivers throughout the healthcare system, but in this instance, particularly around prescription medicine?
And insulin in particular is going to have under the Senate bill, will have a new cap of $25. What were you hearing from people specifically around insulin?
Right. Well, here's an example of a life-saving medicine. It's something that you are required to take if you have diabetes, and that's 10% of Massachusetts residents have diabetes. And you have to take this every day, and yet we've seen at the same time it could cost $1,000 a year out of pocket. And so it's really a good example that we wanted to tackle first, to just immediately address the out-of-pocket costs. But it's also being used as a pilot to say, what does happen if the state puts a cap on what you have to pay and what you can pay on a month-to-month basis? So that's $25 per month. And we want to see, does it have an impact on the manufacturers, on insurance costs and the like for others who are not using insulin? And so it's a good example of how this bill, if it does finally get through the House and the governor, could have an immediate impact on people's pockets.
I know another piece that people were cheering was the fact that when you get to the pharmacy, if you're picking up a medication, you will be required by law to be shown the alternatives that might be less expensive than the one that maybe you were prescribed or the pharmacist filled. I know this is the problem my mother ran into with my grandmother. We're talking about a drug that she was paying hundreds of dollars for every month, and the bill was cut down to $3 or $1 for the same exact type of drug.
Amazing.
Were you hearing these similar types of stories from people?
Yeah, there are a couple of elements to this. One is that the pharmacists now have to say also, hey, your copay is this amount, but the drug is actually this amount. Why don't you just go and pay for the drug directly? And so that's the clarity of transparency and fairness in pricing that we were going after. And so now that would become the law if this were to pass.
There were opponents also to this, among them the Massachusetts Biotechnology Council, and they were concerned that the legislation really wasn't looking at the right thing. They wanted legislature to focus on out-of-pocket costs, which, the State House News reported that total healthcare expenditures in Massachusetts hit $60.9 billion. $60.9 billion in 2018. Is the Biotechnology Council right? Should you have focused on that instead?
Well, there are a couple of elements. There's another piece to this bill which essentially says we need transparency. We get caught off guard too often, and really high cost drugs will come on the market, and drugs that they fit a couple of categories of concern for us. One is that they might be expensive and critical, and so if from a public health perspective, if people are not getting access to them, that's a deep concern for all of us. And so a third element to this was that the Health Policy Council Commission can essentially engage with the pharmaceutical companies and say, we think from our estimation that is too high of a cost, and let's go engage in a mechanism for trying to reduce that. And that's all confidential, that process. And but they could, if the pharmaceuticals refuse to engage in that, then we could take it into a public process where they really have to make their case. Because there are a lot of, I think if you're like me, we understand that the costs of drugs are getting way too high, but we have no reason to understand why. It's behind a cloak. And so this is an effort to try to bring more transparency to the whole industry.
Yeah, but we're talking about the cost of prescription drugs here, but that's not the only out-of-pocket cost. Sometimes there's surprise medical billing that we're hearing a lot about, or there are other costs that you think, I have insurance, I have gone to my doctor, which was in-network, and now I'm still getting a bill. Yeah. What do you do around those challenges?
Right, and so we are going to take up a second Health Care Act. If you remember last term, we took up a Health Act in the Senate, and it didn't move much further for a number of reasons. And so that will be a focus in moving forward. We have we've been taking a lot of swipes at this. In the budget, we also took another effort to say that can we reduce costs by doing essentially expand our rebate program. And so that's another effort that says, okay, at least we can lower the costs that the state pays for a lot of these. So that's through Medicaid. But ultimately, we really want to get at the underlying costs within the pharmacies and be clear: is this something that's necessary or not?
As you well know, the November 20th break for the legislature is fast approaching.
Unfortunately,
busy times. How are you approaching that in your mind? What's the one thing that you really think that needs to get done by that deadline?
Can I say two things?
Sure.
We have the closeout budget, and so we had $1 billion surplus from last fiscal year, and there are a range of critical elements that are in that. That's in conference, and it hasn't gotten across the finish line. So I would really like to see that.
Yeah, State House News now projects that $1 million will be lost because
Right.
the legislature has not had that money all tied up and finished to collect interest.
That's right, and there's a lot in there that is, can wait. If it's our contribution to the rainy day fund, that'll take it up to over $3 billion, but there are other really critical elements. So that, I think we all have our eyes on that. The other one, of course, is the Student Opportunity Act. So the $1.4 billion investment in K through 12 schools over 7 years. We would really like to see that get over the finish line as well. Maybe a little more flexibility in timing, but we have the momentum. We won't come back until the new year, and so this is really an opportunity, I think, to get there while we're close, and we are close.
Do you think that this is an opportunity or requires that leadership at the House and Senate level really look at how legislation is taken up, how the calendar is planned? Because it seems like here we are yet again racing toward the finish with a lot of unfinished business.
Yeah. The good news is this isn't the end of the session. It's just the year. So the session ends in July, and so that'll be the critical deadline. And we really, if we have a lot that's open by then, we're in trouble. But right now, I think to some degree we feel like this has been a relatively productive year, and the fact that we can be this close on such a big initiative like the School Opportunity Act, we're in a good spot. But we really do need to move quickly because we're talking, many of our schools will be receiving in year 7, tens of millions of dollars more than they are right now, and just really finalizing that is important.
But relatively productive year. Do you really think that? Because Mike Dean, my colleague at WGBH, looked at it, and when you take away, liquor license or hyper-local bills and laws that have been passed, 21 laws have been passed as of the end of October.
Yeah, I think there is a natural cycle to the legislative session. It's a 2-year session. Just in my committee, I'm the chair of revenue, and we had over 500 bills. And honestly, it was just last week that we finished all of our hearings for all of those. And so there is a natural course to do your due diligence on the bills in front of us. But it is ironic that we're going to be in December thinking about our consensus revenue picture to start up the budget again for next year. So we're moving right along already into next year, and we haven't even finished this one yet.
One bit of national news I want to ask you about. You may have heard former Massachusetts Governor Deval Patrick tossed in his hat for a presidential bid for the Democrats ahead of 2020 here. What do you think of that news? What do you think of the former governor getting into the race?
Well, I guess I'm an example of the challenge he might face. I've been incredibly supportive of Governor Patrick, and in fact, he has a house in my district, and so we see each other quite a bit. And so a year ago, it was a very different conversation I was having with him. Since then, I've gone on and endorsed Senator Warren.
Yes, you have.
And so there's that's part of one of the dynamics that he'll be facing is that the field and the race has moved quite a bit in the last year. And so that speaks a little bit to the, when you're behind the pack in terms of fundraising and getting staff in Iowa. And, he does stand well in terms of New Hampshire and then moving on to South Carolina. And so he can probably absorb not having that level of staff because of familiarity, particularly in New Hampshire. But I think I'm not going to say a bad word about him. He's been amazing. And so I wish him all the luck.